Bonnie, I'm so excited to be teaching and learning with you today. These are unprecedented times. I pray that you and your family are safe. I wish that I could see and hug all of you, but this is a great way for us to learn and connect, because I know that when this is over, and it will be over, we can have great tools in our toolbox to be able to soar amongst the stars and have create the great career that we love, because I can assure you that beauty and booze have been around for a long time. So let's get to the presentation. So we're going to be talking about advanced exfoliation techniques, and I have about 45 minutes because I want to leave 15 minutes for Q&A at the end. And then if we don't get to answer all the questions in the survey, I will be answering a lot of questions. I also want to be able to do certification classes every week with you. Obviously, this is theory only. Josh will be sending links to videos to complement the classes. And I have some great ideas for classes going forward, but we also want to have your input of what classes you'd like to see. And every week we will be having free online certification classes for everybody that wishes to attend, because I love supporting the industry, and we're all in this together. And I really appreciate all of you attending today. Josh will be answering any of your questions as I'll be going through the lecture. So if you raise your hand, Josh is going to try and get through as many of questions that you may have pertaining to learning with Elaine Sterling. All right, so here are some of our outline today, which I did have in the meat of the email. So this is what we're learning today. We're going to talk about the skin. Chemical peels have been around since Cleopatra, and the skin loves chemical peels. Our skin is acidic naturally, so it loves to be in acidic state. So it's very receptive to chemical peels. The skin is the largest organ of the body. It is thinnest on the eyelids and thickest on the soles of the feet. It is a fine texture, slightly moist. 16% of body weight and protection from the environment. So, you know, the skin is really there to protect us from the environment. And you know that from washing your hands and making sure there's no cuts on your hands. So this is a barrier and a protection from the environment. The peels in the spa that you mainly deal with is in the epidermis. There are superficial peels, medium peels, and deep peels. And so if you can see how much sensory, sebaceous gland, erector pillar muscles, and hair follicles, all of that is happening in the upper and lower dermis. So we sort of grade peels, if you were, spa grade, medical grade. And that's just so that you know what you're working with. Now you have to work in your scope of practice. And I always do this as a disclaimer, because I don't know what the rules are in your state. Every state board is different, and your state may say that you can only use a certain pH. And the reason why they say that is because they want you to stay in the epidermis. Now, if you work in a medical spa or have a medical director, then you probably are going to be using lower pH peels, higher percentage acid peels that they call medium to deep peels. The other thing you can also make sure you do, let's say you work in a state that doesn't have a licensure, or that they don't have any rules and regulations on their state board, you all should have liability insurance. And so your liability insurance may say, what pH peel and what percentage acid you can and cannot use. Now, for example, Associated Skincare Professionals have a new, and I don't have their liability insurance, but they do have, actually me personally I do, but they do have an advanced aesthetic insurance, which covers chemical peels and some of the advanced modalities that you do. So that's a great one, and there may be others. And then I do have a medical insurance for my spa that encompasses all the services, the medical grade services that I do in the spa. So it's very important to have liability insurance. It's very important for you to have liability insurance for yourself, even if you work for somebody else. So look at what's available. I think it's important to be an aware consumer and look what's out there, and then make a list of the services that you provide and provide that to your insurance so that they can say that you're covered for those things, and also look on your state board website to see if there's any restrictions. If you need, for example, in Georgia, we definitely need a assistant laser license from the medical board if you're doing laser. And then, of course, if you're doing the micropigmentation of the brows, you do need your tattoo license. So if you look at children, you see that their faces are plump and juicy. Why do they say plumpness when you're younger? Because of the volume that's in the dermis. I like to say estheticians are in the volume business, right? Because the dermis is 25 times thicker than the epidermis. It is made up of protein fibers, which give the skin strength and elasticity. So think of an elastic band. If you remember those old-fashioned elastic bands that we used to wear in our hair that kind of tore our hair. You leave that out in the sun, those elastic bands get brittle and they break, right? Same with our elasticity in our skin. It gets brittle and it can break and it can wear down with age, with hormone, with sun damage. So we want to rebuild the skin. We want to give the skin the ability to heal itself and renew itself and increase cellular turnover as we get older. So you know that we have the 5 layers, 6 layers, depending on which medical platform you look at. But we know that our cells start at the bottom of the epidermis and that epidermal dermal juncture, and then they start to divide and shed off. And we know when we're younger, it happens quite quickly. And then as we get older, it slows down through the different processes. So by doing micro wounding services, you are triggering that wound healing effect in the skin so that you can build collagen elastin, so that you can help heal the skin, so that you can work with hyperpigmentation, acne, whatever skin conditions that you may be dealing with. And you know, really with chemical peels, we're looking at hyperpigmentation, acneic skin, follicle blockage, kind of like bark on a tree. If you think of like I'm sure you've seen some clients or some people's skin that have, you know, a rough texture to their skin, and it almost looks like it's got oil and then dead skin cells and then oil and then dead skin cells. So we're kind of trying to get rid of that bark on the tree so we can get a fresh new skin. Now the dermis is divided into the superficial papillary layer and then the reticular layer. So why this is important, we are not going into the reticular layer unless there's some sort of anesthetic involved. So we're mainly, as an esthetician, working on the epidermis, and then if you have some medical grade peels, you're really on the upper layer of the dermis, and that's important. And then when you are working in the upper layer of the dermis, there is going to be more downtime. So that's another thing to consider with your clients. How much downtime? You know, how much social downtime? Kind of like that word social distancing. How much social downtime? Now, quite a lot, right? But if somebody is going to work every day or is a public speaker, they may not want a lot of erythema on their skin, or they may not want a lot of shedding of skin. So that is a conversation to have with your client in your intake form, deciding if they're a candidate for which particular peel you have in your cupboard. Oh, look at Barbie, she's gone through a lot. She must be a couple of 100 years old by now, right? So there are some distinct aging factors. I always say, look at your mother, look at your father, your grandmother, your aunt, your uncle. You pretty much can see how you're going to age, right? So the genes are inherited, and those are called intrinsic or internal aging, because the bottom line, there is no such thing as really anti-aging, right? we are trying to get the skin to behave as if it did 5 years ago. I always say, we want to look the best that we could be at the age that we're at, right? I'm never going to look 25, 35, or maybe not even 45, but how can I look the best that I can look now? How can my skin, my elasticity, the firmness, the texture, and the other hormonal fluctuations that I see on my skin with the reds and the browns, what can I do with that, right? And then there's, of course, the extrinsic aging, the external aging, and that is caused by environmental factors, such as exposure to the sun. So we have our intrinsic aging and our extrinsic aging. So you will see an aging process in your skin, right? And you could see signs of aging as early as in your 20s. I'm sure some of you have seen people, and in their 20s, they look, you know, they look their age, and then some of them are starting to see signs of aging already on the skin. So signs of aging are fine lines and wrinkles, thin transparent skin, loss of underlying fat, hollowed cheeks and eye sockets, as well as a noticeable loss of firmness on the hands and the neck. Because remember, in your chemical peel dialogue, it's not only the face. We could work on a lot of parts in the body, but I want you to think of hand treatments. I want you to think of neck and definitely the décolleté. So think of face, neck, and décolleté as part of your add-ons and upgrades in your service. Bones shrink away from the skin due to bone loss, which causes skin to sag, dry skin that may itch, inability to sweat, graying hair, hair loss, unwanted hair. Genes control how quickly the normal aging process unfolds. Some notice those first gray hairs in their 20s, and others not seeing gray hairs until their 40s. So likewise, you may see some people in their 40s and 50s that do not have any signs of aging yet, right? And that's in our Glycolic index, which I will talk about a little bit later. So we are really not treating everybody the same when we are customizing our chemical peel facials, treatments, or services for the clients. So this is a famous picture of a gentleman that was driving trucks. And remember, when we're driving in the car, the sun is definitely hitting one side of our face, right? So the sun damage, gravity, sleeping position, and smoking. Smoking asphyxiates the skin. I cannot say anything good about smoking at all. The only thing I can say is if you do have clients that work in a smoke environment, whether it be they're working because they're a chef, or they cook in a restaurant, or they're working in a bar where they still allow smoking. I can't imagine, but I'm sure there still are bars. So, you know, you can't tell them, oh, you need to quit your job, but you can give them a lot of antioxidant type facials, oxygen type facials, and chemical peels that have antioxidants like vitamin C to help support their skin due to the environmental process. So aging is a complex process with cellular changes, collagen depletion, hormone loss, free radical damage, muscle movements, right? Muscle has a memory. We know that from working out. We know that from microcurrent, right? And animation leads to more pronounced wrinkles, and over time, they will look more pronounced. And so that's where some of the microcurrent and Botox type therapies come to fold, because we're trying to train that area not to be used so much, to kind of a preventative, right? A prequel as you were to aging. Okay, so we talked about this. Definitely, you know, I didn't see much aging on my face, I have to tell you, from 25 to 35, but I definitely saw a rapid increase from there. And also, not to diminish the fact that I really believe our ovaries are our fountain of youth in women, where, you know, that really does regulate our skin's ability to have the beautiful oils in our skin, to lubricate the skin, the moisture content in our skin, right? So we need products and home care to mimic those beautiful fats and lipids that we need to support our skin. So here's some fun facts. you know, I've been teaching this class since probably let's say I've been teaching it for close to 17 years. And so I keep updating the slide, and the last time I had updated this fact slide was 2014, and I thought, goodness, I've got to update it for you guys. Well, believe you me, nothing had changed as far as the top non-surgical procedures on the Academy of Plastic Surgery. Still, Botox fillers, laser hair removal, chemical peels, and microdermabrasion. Let's include those hydro and the hydrofacials and the microdermabrasion. Those were still the top 5. And I'm sure that, you know, microneedling and dermaplaning is definitely, we could add to that, right? But also they had an interesting thing about how, what was up, and the minimally invasive procedures were up 2% from 2017 to 2018. So that's kind of telling you how your clients are looking for smaller procedures more often, as opposed to the bigger procedures, right? And then let's not forget that there is, of course, the baby boomers, right? That 54.9% of whom are female, and that's huge. So let's get into our chemical peeling. So, like I said to you, it has been used since Cleopatra, right? And they really have, what have they done? They've sort of customized it. They've created, you know, designer peels, and they've learned how to work with these peels to be able to control minimal wounding so that there's less damage to the skin, right? Because I always say, if you continue to wound the skin, you're just going to end up with a wound. So how do we do chemical peels where we can keep the integrity of the skin without causing damage, but target the results, the needs of the skin? What does your client want to change about her skin? So what is a chemical peel? A chemical peel is a solution applied to the skin to trigger a blistering effect that loosens the target outer layer of the skin to peel off in the affected area. Underlying regenerated skin is smooth and less wrinkled than the older skin. My goodness. Imagine your clients coming into the into the spa and you saying, Mrs. Smith, I'll peel off your skin. I'll now charge you $200, right? So we have to explain to the clients what is the benefit, right? What is the benefit of this peel? The benefits far outweigh the risk, and especially when we've gone through our client consent form and we've really gone through the contraindications, you know, we have to explain, well, these are the realistic goals of the skin. This is realistically what we can achieve with these chemical peels. And this is unrealistic, right? It's not a facelift. And we have to be careful because we want to under-promise and over-deliver, right? And especially with those before and after pictures are really important because your client forgets what their skin looked like 3 months ago and the achievements that you have been able to do. Your wonderful work. So some of the things you can achieve with your skin, you can definitely achieve retexturizing the skin, restoring radiance, skin rejuvenation, minimizing fine lines and wrinkles or writers, restoring moisture, definitely with a lactic acid peel. We can restore beautiful moisture to the skin, right? Improve circulation, because we definitely are detoxifying the skin. We're increasing circulation, new cellular turnover, improve imperfections, stimulate new skin growth, stimulate collagen and elastin, and create more healthy, vital skin. Realistic goals. We can correct sun damage, mild scarring, pigment disorders, follicle blockage, blackheads, comedones, improve the appearance of stretch marks, acne, depending on the grade of acne, correct, improve melasma, improve uneven texture, improve superficial lines and wrinkles, improve rosacea. That's an interesting one, right? Mild rosacea, definitely with a very low grade salicylic acid, even an AHA, you can see some lovely results. An azelaic acid is fantastic. And alleviate excess oiliness, definitely with salicylic acid, fantastic with its antibacterial, antimicrobial properties. So what are unrealistic goals? You cannot remove the appearance of blood vessels on the skin, right? We need a sclerotherapy, an IPL, a laser to do that. The pore diameter, we can certainly tighten the skin. We can certainly remove the debris and stop further. But I question, actually changing the pore diameter without more of a microneedling or a deeper type of resurfacing, definitely with the medical grade peels. Keloid scars, that would be a contraindication right there. If you have somebody that keloid scars or hypertrophic scars, this would be a concern to me, and you may want to look further into that. If it's a very deep whitehead, there may have to be some fillers and lots of peeling actions and a deep medical grade peel with downtime. Chemical peels are not a facelift. So let's talk about the pH of the skin. We know that the pH of the skin is definitely more acidic, right? And so we know that our learning of the pH of the skin, that we don't want to use anything that's alkaline on the skin, because we do not want to disrupt that acid mantle, all right? So that the skin has to get back to where it needs to be. And that's why when you hear about the cleansers and the products being in pH balance to that 4.5, 5.5, or maybe even 6, that means that it's not disrupting that acid mantle, because then your acid mantle is fighting back to get to the pH. But when we drop the pH, let's say, so if you have a look at my pH scale, let's just say medical grade peels, and it's an Elaineism, so I don't, look at that. Anything below a 3 is definitely, I would call, more of an aggressive peel. But what's nice about using an acid that's lower in the pH, less time on the skin. So there's your takeaway right there. But if you have a peel, and I don't know what peels you have in your cupboard or what peels you're planning to buy, but if it's the lower the pH, the less time on the skin. And now some of you will say, well, Elaine, do you use, baking soda to neutralize the peel? Well, I don't. I always used to have some handy, but I've never had to use it, because if you think about it, the pH of the water is a 7. You've got a pH of a 3 or a 2. Your skin, that 4.5 to 5.5, what's happened when you've applied the peel, as you're waiting, the skin is almost going to try and neutralize itself, and then you're using water and you continue to rinse the skin with cool water. And those are, of course, with the neutralizing peels. You have things that are non-neutralizing peels, and those peels you would leave on the skin and they would rinse the next morning. So there's another takeaway. You have a neutralizing peel and a non-neutralizing peel. So you have to look at what? Manufacturer guidelines of how long you keep it on the skin, right? And I always say start small. If they say leave it on 3 to 5 minutes, well, the first time you do your client's skin, leave it on for 3 minutes. And then write on their chart, what did you see on the skin? Some reflective practice. And then go ahead and maybe next time leave it on for 3.5 minutes. Because if you're doing a spa grade peel, it's always in a series of peels, right? If you're doing acne and you're using a spa grade peel, you may be doing peels every 2 weeks or once a month. If you're using a medical grade peel, it's 6 weeks of healing. So you're not going to do a peel or an exfoliation on them for 6 weeks. So that's important to realize, okay? And of course, we know, especially in Atlanta, I can speak for Atlanta, that fall and winter and beginning of spring is definitely peel season, right? It's very difficult to do peels in summer. That's where your mild peels more often may play into effect, because there's no ways in Atlanta that you can stay out of the sun, regardless of your Fitzpatrick scale, right? Because you're walking from your door to your car, you're at your children's soccer game, etc. So you're always in the sun. So it's important to be using SPF. Again, Elaine says chem-free SPF, because a chemical is an irritant to the skin, okay? So that's important. And of course, you have to to reapply and wear sunglasses and wear a hat, etc. So let's look at our Fitzpatricks, right? Fitzpatrick 1 is a very fair blonde, light eyes, red hair, say your Lindsay Lohan type of person. And that person can pretty much have every peel, right? And I always say to be careful. I teach my students, if you're not sure, let's say you look at me, you say, well, Elaine, you look like a Fitzpatrick 2. If you're not sure, go ahead and class me as a 3. Definitely in the summer, because my skin may be a little darker because I can't help but, you know, be in the sun. It's sometimes. Go ahead and class somebody as a 3. Likewise, somebody is a 4 and you're not sure, class them as a 5 until you can absolutely see what their skin can tolerate. I always say 1 foot on the gas and 1 foot on the brake. That's when it comes to you know, these medical spa services, paramedical skincare services. You know, start slow. See what your skin, what their skin, your client's skin can tolerate. Write your notes. Write charts. Luckily, if you have an online booking system, there's going to be an area for notes. You can make your notes of what you saw on the skin. You can take your before and after pictures. So when they come back in, and of course they're going to say they had lots of services at other places and that they can have all kinds of services on their skin, but you are in charge of their skin. You're the boss, right? So 1 foot on the gas and 1 foot on the brake. And what I would say with peels, there are definitely peels that are only 1 through 3. Then there are definitely blended peels out there that you can definitely do on 4s and 5s. You know, 6s probably don't need a peel, you know, so there are definitely peels for every skin type, every skin condition, and every Fitzpatrick now. And you remember, I am doing a generic class, so I am teaching you theory and what to look out for when you go purchase a peel. The Glaucoma Index just tells you how is that skin aging, right? Somebody in their 20s may start seeing signs of aging. You may have somebody in their 40s that are still a type 1. And that's important between the Fitzpatrick and this index for you to design a service that you feel is right for your client. Contraindications are very important. Remember, we are looking for an intact epidermis. We are looking for a healthy client, right? So we do have some issues here, and some skin conditions that you see on the face may be a roadmap for what's happening in the body. So a complete intake is important. And guess what? I don't know every disease and disorder. I don't know every medication on the market, right? So it may take some further investigating. What are you taking that medication for, right? We must make sure that there are no open lesions and wounds, right? So if you have a picker, an excoriator, this may not be a service for them, right? If you have somebody that is doing a lot of their own extractions at home and there's a lot of scabs, let's wait for those scabs to be healed. Let's have an intact epidermis. For spa grade peels, and you're in the spa, you definitely want them to be off their retinoic acid, their retin-A, their tretinoins, whatever they're using. I say at least 7 days. Accutane, we used to say 1 year, off it. They now say 6 months. I believe it's illegal in most places, so, but we still add that to our intake form. Why do I say that? Let me just say that if you are working in a medical spa or using medical grade peels, there may be retinoic acid or some tretinoin inside the peel. There's definitely some retinoic acid peels out there. But if we're in the med spa, the protocol varies because they may tell you to use your retin-A type products, the Tazarac, whatever the brand is, up until the day of the peel to get a deeper peel. But in the spa, because I don't have a doctor in my office that can, you know, come down the hall if there's a problem, I want to be able to take away any issues, if that makes sense. So that's important. Active cold sores, which are herpes, is an open lesion. Plus, you can spread it to the nose or to the eye. So I want you to make sure that you're aware of that, right? Some topical medications or antibiotics may be a contraindication. Facial waxing, got to stop that 70 days prior and 70 days post, because guess what? That is an exfoliation, right? So you have a consent form that explains everything. Also have a post-care kit for them. What is their cleanser? What is their toner? What is their SPF? What is their protective agent? Because you want to make sure they're using ingredients that can include and protect and heal the skin post-procedure. First, do no harm. Because if there are chemicals and fragrances and essential oils that are in their products that they're using, that can be a skin irritant, okay? So post-care is important. Guess what? I think it's a great idea to make your clients sign a pledge. What does that mean? That means that they understand that there may be some discomfort, that they understand that you cannot guarantee the results of the service, that they will not pick, that they will get back to you if there's a problem, that they'll stay out of the sunbed and sun exposure. You're giving them a lot of information during the service. So for them signing a pledge and signing a consent form and them going home with a post-care form, right? And then you calling them 24 to 48 hours post the peel to follow up and make sure that they're following your post-care instruction is vitally important to the success of the peel. So types of peels. There are alpha hydroxy acid, AHAs. Now, here's another takeaway. Your endpoint with AHAs are definitely erythema. Your endpoint with your BHAs, JESNAs, TCAs, or that coagulation of protein, that frosting on the skin, kind of, that is your endpoint. So you may or may not see erythema. Now with a blended peel of the AHAs and the BHAs, you may see both, but you may not. Guess what? It depends on the thickness of the skin. It depends on how well you've degreased the skin. It depends on how many peels the client has had, the thinness of the skin, how much oil there is on the skin, how well you've degreased or defatted that skin prior to the service. So our AHAs, we have glycolic acid, which is from sugarcane. Lactic acid is a milk derivative. Mandelic acid from a nut. Our citric acid, which is our vitamin C. Our tartaric acid, which is grape. Our ascorbic acid, which is our C. Pyruvic acid is a blend. I call it the champagne peel because those are your apples and your grapes. So we have the classifications of peels. We've got the very light peel. We've got the light peel. We've got the medium. We've got the medium to deep peel, and we've got the deep peel. Okay. And we do have our beta hydroxy acid peels. And our beta hydroxy acid peels, remember, they are the ones that are going to kind of, think of boiling an egg. They kind of coagulate the protein in the skin, all right? So think of it that way. So your end point on the skin is maybe some light frosting or some blanching on the skin. But then we also have another class of peels, which are our enzyme peels. Think of Pac-Man. Now, some of you may not be old enough. I'm definitely a child of the 80s. That's why I bring back the flip phone. So think of the Pac-Man, and it's eating, digesting, kind of like your stomach is digesting the food. The Pac-Man is digesting the dead skin cells on the skin. So we have had traditionally, our traditional enzyme peels are our papain from papaya, our bromelain from pineapple, and our pancreatin from the beef or other animal products. And so obviously in America, we're not really using those, but you may have some European peels and they still have that in. You definitely get people who are allergic to papaya. Now those were your traditional enzyme peels, but you get other enzyme peels now. You get the pumpkin, you get blueberry, mango. I tend to go very red with enzyme peels. So you may have people that have some fruit allergies. So those are things to be aware of. So your glycolic is derived from the sugar cane. And it really did revolutionize skin treatments in the 90s. I say that Glycolic is your gold standard of peels. It's your go-to. Excuse me. You can definitely neutralize it. Now you can get a 10% up to a 30%, right? Remember, the darker the Fitzpatrick scale, I would suggest using a lower percentage of acid to really control that, because Glycolic peel is very corrosive. And, you know, I find I may leave it on the skin for 3 to 5 minutes. It could take me 15 minutes to neutralize. It kind of keeps eating away at the skin, right? Your end point is erythema. We have a Jesnes peel, excuse me, or other types of peels, which are blended with AHAs and BHAs. And so they're able to do 2 things on the skin, right? Exfoliation and digestion. So they have 2 roles there, and there may be downtime, and there also may be restrictions on the pH of the skin. And then there may be some blended peels that do not. Again, I'm asking you to follow your manufacturer's guidelines, 1 foot on the gas and 1 foot on the brake. And if you're in doubt, don't. Then start with more, start with, you know, what I call like lighter peels more often, your spa grade peels more often, and then also get them on an at-home glycolic gel or mandelic serum, mandelic acid serum, where they could be using that at home to help desensitize and pre-treat their skin prior to these peels. So here's some things that we're doing with the Jesnes or the blended peels: your dry skin, your sun damage, your aging skin, your blemishes. Now they will feel feet. So what do we feel with these peels? We feel with our AHAs, our alpha hydroxy acids. I always say with Glycolic, you feel like spiders on your face. With lactic acid, you feel millions of spiders. Why? Because lactic acid is a slightly larger molecule. It's not going to be as corrosive, right? And you're definitely going to see some erythema on the skin, right? That micro wounding, if you were. And then the Jesnes peel or the BHA peels, the client's going to feel heat, and that's definitely something they're going to see. And there's going to be a sunburn, and that's going to go away. And then wherever there was that coagulation of the protein, the blanching of the skin, that's going to peel. So it's really important for the client not to pick the skin. And if you do a full peel where there's going to be a lot of shedding, you may want the client to come into your spa. Good idea is 2 weeks afterwards, so that you can see the skin. You could do some LED, and you may want to do a light 1 pass of microdermabrasion on like the lowest setting, just to get rid of any peeling, because I guarantee they're going to pick at that skin. It's a real problem, I want to tell you, with people picking their skin. And you know, that can pull and cause a wound, which could cause some hypertrophic scarring, or even some hypopigmentation or hyperpigmentation, which is what we don't want to have. We're trying to fix those things, right? So they need to be aware, and you're going to make them aware to begin with that this is social downtime, that you're going to prepare the clients psychologically. Of course, if they've had many of these, are like, bring it, because they love the results on the skin. And then, you know, you may have the no downtime peels where there isn't. But you'll know from your marketing and collateral that you have, and the training collateral that you have from your company, what your client is going to expect afterwards for the post-peel management is extremely important. And the home care. So you've got to send them home with your post-care. And really, it's a 1, 2, 3. It's really a 1, 2, 4, because you're going to have your cleansing and your toning and your healing agent, and of course your SPF, right? So we have protocols here for Jesnes. That is, if you have a peel, and you know, there are ways to use these traditionally non-neutralizing peels, and you can neutralize them, and then I call them a flash system. So let me give you an example from me. If I do a Jesnes peel, I don't want to have lots of shedding because I've got to go out. So if you neutralize that peel, I'm not going to have as much shedding of the skin, but I'm still going to get benefits of the peel. So you can turn your non-neutralizing peel into a neutralizing peel, most definitely. And here we have salicylic acid. Again, if somebody's allergic to aspirin, I want you to be aware of not using this peel, right? But definitely has an antiseptic, antimicrobial action on the skin. So that's excellent for the skin. I'm really big on, you know, okay, what do we have in our cleansers that can really cleanse the skin since we've been outside and exposed to the environment? Salicylic acid is a great ingredient to have in your cleansers. Also using a degreasing agent, using a foaming cleanser to thoroughly degrease the skin prior to any peel is important. Do not use a cleanser with a oil. If you do use a pre-cleanser with an oil, I want you to make sure you're using a cleanser that maybe even cleanse the skin twice to thoroughly degrease and defat the skin so that you can get a nice, deep, even peel. Because remember, on a combination skin, where is there more oil? In the T-zone, right? So you want to be able to really degrease that area thoroughly, because it's going to be much easier to degrease drier areas of the face. And so your salicylic acid is fantastic for acne. Fantastic, fantastic, fantastic. The only thing is that I would say is, you know, use a lower percentage on your Fitzpatrick's. Always say 3 with caution, right? 3 with caution, because they may be a 4. Again, you've got to get a thorough history. What is that person? Where are they from? You get light Italians and you get darker Italians, right? So don't just assume because that person looks like they have a fair complexion that they fall into that 1 or 2 category. Got to say, how long do you stay in the sun before you burn, tan, change color? And also, you know, what is your heritage? That's important, very important in your intake. TCA, fabulous, been around since the 1800s, right? The chemical composition from the modified vinegar, fabulous, fabulous for acne. And it is in your modern blended peels that you can use on darker Fitzpatrick's in a very lower percentage. And again, if you're not sure and then use lower peels more often, lower percentage peels more often. And remember, the lower the pH, the less time on the skin. Your medium depth peel, you're going to need some wound healing and some aftercare. So this is definitely in the doctor's office, not in the spa. All right. And those deeper peels that penetrate to the reticular dermis, the laser, the Baker's fennel, the fennel peels, you're under anesthetic. So we're definitely not doing those. And there is a lot of downtime for those peels to be inside so that your skin can regenerate and heal so that you don't cause further damage. So the fundamentals is that do not peel the red skin. Have an antidote for heat on hand. What do I mean by that? Have a bowl of cold water. You can put ice in the water. Never put ice directly on the face because you can cause an ice burn on the skin, right? Ask the client from 1 to 10, 1 being the least, 10 being the most in this peel. What is the sensation that you're feeling? If the client says she's at a 6, remove immediately. Is she freaking out? I don't know, you know, but I can't feel her skin, right? If she's at a 5 of the sensation, I'm going to leave it on the skin for 5 more minutes. Well, 5 minutes, sorry, for like a few more seconds. And I'm going to see, remember on that scale I talked about where when you apply the peel to the skin, the sensation increases and it starts to level off and then it starts to go down. Is that what she's feeling? So I'm going to just see, and if it continues to increase, it's time to remove. And I'm going to have my clean bowl of water, clean water to neutralize. And remember, if you're using a neutralizing peel, it may take 30 minutes. I'm not letting that client go home until she's at a 0. Now, obviously, if she's using if you're doing a non-neutralizing peel, then they're going to go home with a peel on the skin. And then they're only, the peel on the face. And then they're only going to wash it off at the next morning. Usually they're going to sleep with it on, right? So we want to be thinking about the different levels of peeling with a non-neutralizing peel. what type of peel are we using? Is it a layered peel? Is it a non-layered peel? Is it a very superficial peel? Is it a superficial peel? Is it a medium depth peel? Is it a deep peel? What are the downtime? Have we degreased the skin well enough? All of these are factors that go into a successful peel. I think peels are still the gold standard in skincare. It's still, I love chemical peels. The skin is very receptive to peel. You see beautiful results with the peels. I want you to be well trained on the peels. I want you to understand what peels are right for what client. One peel is not enough to have in your little toolbox of things in your treatment room. Also, coupling the peeling treatments with services is fantastic. You can do peels with microneedling, with dermaplaning, with your hydro or hydrofacials. LED after the peel is fabulous because that also gives you an opportunity to watch the tissue response on the skin, to watch the endpoints that you see on the skin, right? So creating these skin cocktails, as you were, with your spa grade peels, with your medical grade peels that have 6 weeks of healing. You may just be doing the peeling with LED. They may not be able to couple those with different services that you have in your treatment room, right? Again, start slow with your client. You want to see how your client does on these peels. I love chemical peels. They're my favorite services. I think they're fantastic. So now we're going to go ahead. I'm going to end the slide here, and I'm going to take it to our Q&A and back to our Zoom meeting. And so we can carry on with our learning.
Okay. Hi, everybody. All right, so I'm going to go into the Q&A now. So Elaine, I'm going to throw some questions at you. So our first one is from Shirami, and it says, which clients, or can chemical peels be applied to clients with albinism or vitiligo?
No.
Okay.
That would just be a no. And you know, if they want to go ask their dermatologist, but I wouldn't do it personally.
Okay. Jasmine Kemper asks, what is the age range for a peel?
Good question. Look at your spa. Does your spa have a rule that they start doing services on a 16-year-old? Obviously, we're seeing hormonal fluctuations from an 11-year-old to a 13-year-old. You know, I would say that 13 to 16 depends on your spa. Most spas are saying coming in at 15, 16. So you got to go with your spa rules and regs on that one.
All right. Then we've got Shirami again. What clients cannot receive a chemical peel?
Well, again, we went through that in the training. Contraindications, eczema, open lesions. If they have herpes simplex on the lip that's flared up. Now, remember, you've got to tell them if they do suffer from herpes simplex that they may have an outbreak, because laser and chemical peel, because of the immune system and the immune response, may trigger an outbreak. So they could take the Zovirax or the Aclavor, I don't know what they're on, the day of the peel and continue that for whatever that, but it may ignite a breakout, right? Autoimmune disorders are a problem because what are we doing? We're causing a micro wound. So some may be contraindications and some may be, hang on, you have this autoimmune disorder. I need you to go talk to your dermatologist or your doctor, because there is going to be a wounding and then an autoimmune response to the skin. Is this the right treatment for you? Because really we're looking at hyperpigmentation and acne and blackheads and excess oiliness, hyperpigmentation, writers or wrinkles. These are the things that we're looking for on the skin.
Okay, so the Skin Spa of Wake Forest asks, what chemical peel is best for rosacea and what can it do for the skin condition?
Fabulous question, because I have rosacea. So azelaic acid, mandelic acid. Remember, rosacea can be caused by a mite. It can be a bacterial. It can be all kinds of interesting things. It's definitely a vascular disorder. So I want you to think of peels that create heat may not be right. But When we go back to the salicylic acid slide, it's antibacterial and antimicrobial. So if you have a skin, you have a rosacea that's an acneic rosacea, a very low grade, like let's say an 8% salicylic acid, a mandelic acid, fantastic. Azelaic acid, fantastic, because it's got that antibacterial, antimicrobial, but also wound healing, anti-inflammatory properties in that peel. So you want to use the lower percentage, and you want to do one, see how their skin reacts to it, right? Do some LED with it. But any peel that's going to create a lot of heat in the tissue, think of that. You wouldn't do the steaming on the skin anyway, so you wouldn't want a peel that does a lot of heat. Does that make sense to you? Did I answer the question? Did I answer the entire question?
I think you did, yeah.
Okay.
Oh, I think, hold on, just to make sure. I think the rest of it was, well, yeah, no, you answered it. Okay, so next up, June says, how soon after a peel can a client get a facial?
Fantastic question. Again, manufacturer's guidelines. It may be a very mild peel, right? It may be an 8 to 10 to 12% peel, and that may be just 2 weeks, right? With a pH of 3. Remember, the lower the pH, the deeper the peel. So, but if you're doing one of those medical grade peels, it may be 6 weeks before they can have a facial that includes exfoliation. Okay, so again, the downtime is important, and because there's a lot going on underneath the surface of that skin, right? A lot of healing. We are making that dermis go into wound healing, full-on warrior mode to build collagen and elastin, to heal the skin, to increase cellular turnover, right? Because you'll see, even with AHAs, you'll see a little bit of shedding on the skin. Why? Because of that proliferative, because of that wound healing, we're speeding up the cellular turnover, so there's more shedding of the skin.
Okay, we're getting a lot of, now people are picking up now, so we're gonna do our best. We got 6 minutes left, so we're gonna answer the ones we can, and then like I said, I will send out an email with all of the questions we couldn't get to in the webinar, the poll for whatever the next subject you guys would like, plus a spot for you to put your license and or student ID in, and last but not least, links to other chemical peel demos that Elaine has done. So Elaine, obviously you have your own skincare line, but Eleanor asks, what brands of peels would you recommend, and what is a good peel for stretch marks? Okay, so there are so many brands of peels out there, and there are some really good brands of peels. I would say look for an esthetician focused line that has what I call the living laboratory, right? These are brands that it's just like hair products, right? My hairdresser scared me straight. I do not buy my shampoo and conditioner from the department, what do you call the department store, or the where do we buy groceries? From the grocery store. I buy professional hair care. So I only buy professional skincare lines that have also training with them, right? I mean, I don't want to list brands now, but I think the most important thing is that if you can just buy it on the internet without a license, without training, without product support, then this is not a peel you should be buying, right? Because there are, you know, there's the case studies that go with peels to see what the tissue response is. There is training material. There is somebody you could call that can support you. So there, I would say that's what you need to do is ask those questions. Does the line, do you have to be licensed to buy? Does it have marketing collateral for you? Does it have training for you? Does it have a support team that you can call? If the answer are no to those things, then it's not a professional line and you shouldn't be buying them, because they need to be able to support you in the treatment room when things go wrong. And they will, because it's skin. That's it. All right, great. And then I have here's a tricky one. So can a peel and microneedling be done together in the same session? And if so, how and in what order, says Tunisia.
Well, you know, I always like to do the peels first because I like to see what's going on with the tissue response. Remember, when you're microneedling, there's holes and there's channels, and then the peel can go in. So you might say, well, that's a great idea, but you know, because I'm old school, I've been teaching peels for many years, so I would always do the peel first and then the microdermabrasion. You know, So
microneedling, not microdermabrasion, microneedling.
No, I'm saying years ago when there was no microneedling. I'm just saying I always did the peels first. So it depends how confident you are. And I would say start really slow with it. And also start with a very soothing peel that has active ingredients in that peel that's going to help soothe the skin. Don't do a medical grade peel. Start with a lower grade peel.
All right, and then I think we have time for one more, and it's from Monica. Hi, Monica. Good to see you here. Monica asks, she has an Indian client with melasma that has received several TCA peels from her dermatologist. It didn't help. Why is melasma so tricky?
Because it's tricky. It's tricky because you can actually ignite it. It doesn't. It seems the body wants to make it, and when you're igniting that melanocyte, remember, she needs to be on a lot of tyrosinase inhibitors. And what do I mean that? I mean like a Xanax for the melanocyte. I mean like for the hyperpigmentation. That epidermal-dermal juncture where that melanocyte is being activated. She needs to be on a lot of those vitamin C, arbutin, mulberry, bearberry, licorice, between the peels, and maybe looking at peels, that have licorice, mulberry, bearberry, arbutin, maybe in them, kojic acid. It's going to help suppress the melanocyte as well, and then using that in between. And again, mild peels more often. So melasma is tricky. You can do peels, but I would look for the tyrosinase inhibitors pre and post, as well as peels that have the tyrosinase inhibitor in them, and not go for the big guns out the gate. Let's try and teach that skin to behave a certain way, if that's helpful.
All right, I think we have reached time. I want to thank you, Elaine, for doing this. I think everybody here has learned something. So is there anything else you'd like to say before we sign off?
No, it's just that this is only an hour long, and obviously there's so much that I want to teach you. I just hope that you've taken one pearl of wisdom, a tool that you can use from today, use in your treatment room tomorrow. We will be back. I always say Beauty and Booze has been around since the beginning of time, and so we will be back even stronger. Just give yourself these 4 to 6 weeks to really up your knowledge, up your game. I want you to think of what can you put in your toolbox, in your treatment room, in your marketing for 4 to 6 weeks from now. Because I can't wait to get my eyebrows done. I can't wait to get my facials again, right? But we're going to do things differently, right? I want you to think about what can you do differently in your treatment room when you get back in there. Just 3 things I want to think about is gloves from the beginning to the end of the facial, wearing a mask from the beginning to the end of the facial. If your hair is not up like mine, or is, let's think of maybe, I'm thinking about for my school and for my spa, wearing what they use in the food service, the hair covering. So let's think about things that we can do because we are very important, because we're touching people's lives with our hands and our hearts, and we're connecting with people on a very deep level, and people want to connect. So I want you just to think about, really, I'm giving free webinars. So every week, whatever the subject is, Josh is going to choose from what you guys want and from what knowledge I have. They're going to be free. So, and the certificates are free, because this is what I want to do for you guys. I want to help any way I can. And so hopefully I've helped you today. I pray that I've helped you today, and I pray that we'll be safe. And I love all of you, and I thank you. And I really do appreciate you stepping in and taking an hour out of your day to listen and learn something today. And I hope you have. I hope I've made your day. Thank you.
Thanks, Elaine. Everyone have a great day. And again, look out for that email that's going to come to you after this. It's going to have all the information, the Q&As. It's going to have a place to submit for the certificate, as well as links to the videos and an area for you to tell us what you'd like to see in the next free webinar. So everyone have a great day. Enjoy your weekend, and we'll see you next time.
Bye.
Thanks, Elaine. Bye.